Hey there, friends around the world. I am Dr. José Luis Dinamarca Montesinos, a Chilean geriatrician. I led the orthogeriatrics program at the Dr. Gustavo Frique Hospital in Viña del Mar, Chile, and I am also a professor of orthogeriatrics at the University of Valparaiso, Chile, and at the Autonomous University of Guadalajara in Mexico. It has been amazing and stimulating to work with a wonderful international team led by Dr. Jack Bell in the development of this material, which we are going to review. I hope you like it and find it very useful. Let's go there. So, what can be done to improve the number of people who receive simpler 6 actions? Changes can target increasing the capability of health workers, patients, and carers through better knowledge, skills, and understanding. It is also important to create opportunities to make the right thing to do easier to do. Finally, it is important to consider improvements that motivate people to do the right thing. Over the next few slides, we'll share lots of different ideas for improvement. Some of these ideas might be very useful in your setting. Others might not be relevant, and that's okay. You might already be doing some of these things. And we know for sure that people around the world are doing many other great things that aren't listed here. These are just examples to help individuals and teams start thinking. Please don't try to do everything at once. Instead, we suggest choosing one idea to test at a time. Try it out with your local team and patients. If it helps improve things, great. Keep doing it. If it doesn't work, make a change or try something different. This approach is supported by the model for improvement and the COM-B. If you want to know more about these, links are available in references of this unit. Let's start by looking at how we can improve capability. That means building people's knowledge, skills, and understanding about nutrition. Here are 6 simple but powerful actions we can take. First, we can explain why nutrition matters using simple and consistent messages. This helps patients and carers understand that food and drinks are part of their treatment, not just extras. We can also give people written materials or short videos to help them remember what they have been told. This is useful for patients who may forget things or feel overwhelmed in hospital. We should take time to correct common misunderstandings. For example, that people with obesity don't need extra nutrition, or that supplements are only to be provided to hip fracture patients once they have demonstrated ongoing inadequate intake. It's too late to wait. It helps to give staff short scripts or key phrases so they feel more confident when talking about nutrition with patients or carers. If patients say no to oral nutritional supplements, ask them if they know what they are for. And finally, we can use structured conversations, like the teach back method, to check that the patient has understood. Using repetition and reminders also helps to reinforce the message. These are just some examples of how different members of the healthcare team can support staff, patients, and families to feel more confident and informed, so that nutrition care is understood, remembered, and followed. Now, let's look at how we can create opportunities for patients and staff to talk about nutrition by changing the physical or social environment. Here are 5 ways to do that. First, we can add prompts and alerts to IT systems. These can remind staff to provide nutrition information and make sure it becomes part of everyday care. Next, we can use bedside whiteboards or posters to explain the nutrition plan. This helps make the information more visible and gives patients and carers a chance to ask questions. A really practical idea is to establish a role for a nutrition assistant, someone who can support patients with food, drinks, and education. This can be especially helpful when staff are busy. We can also offer video or online explanations about nutrition treatments. These can be watched by patients and carers when they have time and can help reinforce what staff have said. Finally, we need to review and update hospital policies or care pathways to make sure that nutrition education is included. When it's written into routine care, it's more likely to happen. Finally, let's look at how we can motivate people, both staff and patients, to care about nutrition and take action. These strategies are about building belief, connecting to what matters, and recognizing good work. One of the most effective things we can do is link nutrition care to the patient's personal goals. For example, if someone wants to go home or walk again, we can explain how nutrition helps make that possible. We can also set goals for nutrition information delivery and then audit and report on them. This shows that nutrition education is a priority, just like medications or mobility. Dashboards are another great tool. They can show how often patients are receiving nutrition education. This helps teams and track progress and improve. Real patient stories are powerful. Sharing examples of patients who got better with good nutrition helps staff and carers believe it can make a difference. And of course, let's celebrate the teams who are doing this well. Recognition motivates others, creates pride, and builds a positive culture around nutrition care. These strategies help people see nutrition not just as a task, but as something important, meaningful, and worth doing well. Many different people across the clinical team can help improve how often patients and carers receive nutrition information. Nurses play a central role. They're often the main point of contact for patients, and they can explain why nutrition matters while encouraging patients to eat and drink and check understanding. Doctors can support this by reinforcing the importance of nutrition during ward rounds, especially when discussing treatment plans or discharge. Allied health professionals also play an important part. For example, Dietitians are specialists in nutrition care. They often lead education for both staff and patients. Physiotherapists can link nutrition to strength and mobility goals while mobilizing patients. Social workers can help identify social or cultural barriers to eating well and support shared decision making around treatment choices. Healthcare assistants can remind patients to eat, explain meal options, or help with supplements, especially for people who are frail or need support at meal times. And don't forget students and trainees. They bring fresh energy and often take time to talk with patients. If we include nutrition in their early training, it helps create lasting change in practice. Linking malnutrition diagnosis and treatment plans to patient-centered goal is a great activity for medical students. A nursing student might explain why a patient is getting high-protein drinks. A physio or IOT student could talk about how nutrition supports strength, mobility, and daily function. A dietetics student might use a simple handout or care card to walk through why someone is at risk of malnutrition and what can help. Finally, volunteers can also make a real difference, especially in settings like aged care or rehabilitation. They might encourage people to eat, share reminders about supplements, or help direct patients and carers to trusted nutrition materials. So, no matter your role, if you are part of the care team, you can help make sure patients get the nutrition information they need. Hopefully, you have seen this slide in earlier units, so we won't go through every point. But it's a good reminder that providing nutrition information isn't just the job of the clinical team. System and support teams like admin staff, food service, IT executives, educators, and quality teams all have a role in making sure nutrition information is built into systems, tools, and training. Advocates and influencers, including patients, carers, advocacy groups, professional organizations, and researchers, also help raise awareness, promote best practice, and drive improvements. The key takeaway: it takes a whole system working together to make sure patients and carers receive the nutrition information they need clearly, consistently, and at the right time. So, when and where can we actually improve how often patients receive nutrition information? The short answer is almost anywhere care happens. It can start early in pre-admission clinics, surgical planning, or ED workflows, long before the patient even reaches the ward. There are also plenty of touchpoints during the hospital stay, like bedside handovers, multidisciplinary rounds, or even in physio gyms, where nutrition can be connected to strength and recovery. Don't forget family meetings and case conferences. They are perfect moments to involve carers and talk through what matters most. Systems matter too. Things like EMR prompts, IT alerts, and even how we design electronic workflows can make a big difference. We also need to think about how we train our people. That means including nutrition in orientation, competency frameworks, and simulation or interprofessional learning. And of course, supporting change through quality dashboards, clinical audits, and registries helps track what's working. You can also involve patients and carers directly through co-design of nutrition materials and make sure that policies, pathways, and governance reviews keep nutrition education on the radar. The key message? It's not just one moment. It's built into every stage of care. We invite you now to watch this short 3-minute animation. It shows the difference simpler improvements can make. Mr. E's journey shows how early nutrition care can really help. Even if you've seen this video in another unit, it's worth watching again here. It might be helpful to look out for the things you have learned in this unit. After you have watched the video, we will then invite you to take some time to reflect on what you might be able to improve in your setting. Then it's time to reflect again. What are 2 or 3 realistic changes you think you could improve the proportion of hip fracture patients or their carers where appropriate, who are provided with nutrition information in your setting? These could be changes that influence capability, opportunity, or motivation. Also, think about who could be involved, when and where the change could happen, and why the change is important. Just put in a few of your thoughts. This is not assessed, it's just to get you thinking.